Hello, everyone. Thank you for joining. We're going to give it a minute longer. We're just waiting on one final panelist. But I see we've got a great audience that's joined. So I will get it kicked off slowly with introductions. My name is Natalie Schneider. I am the founding CEO of Fort Health. We are a tech-enabled youth mental health platform built in partnership with the Child Mind Institute. And each month we come together with incredible researchers, clinical thought leaders, community leaders to tackle really big topics that are important to our youth mental health. And today's webinar is no different. Consider these troubling statistics. The suicide rate among Black youth is rising faster than any other racial or ethnic group in the US. Not only that, but Black and mixed race students are more than 3 times more likely to be suspended at school than their white counterparts. And finally, Hispanic youth are more likely to report poor or reduced mental health. What is going on? Today, we will find out because we are joined with folks that have spent their entire careers studying these topics and understanding the underlying causes. And we'll have very practical advice and resources for you. So you'll want to grab a pen and paper. And I am joined by Dr. Janine Dominguez, a PhD. She's the Senior Director of School and Community Programs at the Child Mind Institute and a Senior Psychologist in the Anxiety and Disorders Center. We're also joined by Dr. Charles Daniels. He is the CEO and founder of Fathers Uplift, incredible organization. And in fact, the nation's very first mental health and substance abuse treatment center for fathers and families. We are also fortunate to be joined by 2 individuals from Georgetown University's Childhood Innovation Network. Firstly, Dr. Corey Williams. He's an associate professor in the Department of Psychiatry. He's also a former teacher. And additionally, Mr. Robert Harris, LPC, also from Georgetown, with really incredible insights on just how early these disparities start in kids. You'll be surprised to hear his responses. Please drop the questions in the Q&A. This session is being recorded. And right on time, Ms. Lakeisha Hoffman, so excited to have you here. Ms. Hoffman joins us from the Child Mind Institute. She has over 20 years in K-12 settings, is also the Senior Director of School and Community Programs with our partner, the Child Mind Institute. Welcome, everyone. All right, so let's dive in. First, what do we know about the outcomes of historically marginalized populations? Dr. Williams, level set with the audience. Give us some context. How bad is this problem? What are you seeing with your work in communities?
Well, first of all, thank you so much for the opportunity to speak on these really important topics. These topics are really close to me and close to my work, mean a lot to me, and I'm super privileged to be a part of this esteemed panel today. So thank you. Yeah, I mean, I think that there's been a crisis going on for a couple decades now that has been really understudied and underrecognized, and that is the crisis of Black mental health and Black suicide. The American Academy of Child and Adolescent Psychiatry, as well as the American Academy of Pediatrics and the Children's Health Association, declared a sort of national state of emergency a few years ago in 2021. And what they declared was largely based off of significant increase in emergency room visits that we were seeing nationally, emergency room visits related to suicidal thinking and self-harm. And there was a national sort of crisis of children waiting in line, also called boarding, for inpatient beds. And so the state of emergency was declared sort of based on those things that we were seeing in the emergency room. And while that was important, I think what was missed was a kind of crisis folded into a crisis, which was when you kind of disaggregate or pull out the national data based on race, the numbers look even worse, which you alluded to already. So the suicide rate for Black youth has been rising faster than any other racial group in the United States. And since 2017, suicide has been the second leading cause of death for Black youth between the ages of 10 and 19. Second only to sort of accidental injuries such as car accidents. And early adolescents, Black youth are twice as likely to die by suicide as compared to their white counterparts. Um, and so, given that, so that said, the situation gets even worse when you look at who's actually getting care, and the youth that are ill, that need clinical attention, are not getting into the care that they need. And that's across the board, but again, it gets worse when you break it down by racial group. So only about, depending on the study that you look at, 20% of children are getting into clinical care that have needs that rise to the level of sort of clinical threshold that need to be in clinical care. And only about half of those children, I'm sorry, only about half of those numbers are getting into care if they identified as Black or Hispanic. So about 8 to 10% are actually getting the clinical care that they need. So so all that is to say that there is a national crisis on top of a national crisis in Black communities and other communities of color, and a very small fraction of those youth are actually getting into the care that they need.
So to summarize, this is a very dire situation, and I loved how you framed it. It is a crisis within a crisis. And Mr. Harris, you look at sort of early childhood development. How early do these disparities really start? And what, if anything, can parents do about it?
I also want to echo my gratitude for being in the space with some really amazing people who I've heard about or had the privilege to sit in spaces with. And the answer, you should actually go as far back as during the prenatal period. Like that's where the disparities exist. I have the privilege of working with Head Start and Early Head Start as an infant and early childhood mental health consultant with Georgetown. And to sum that up, what that means is the emphasis on infant and early childhood mental health. And when we talk about that, we really talk about then the entire unit that surrounds the child, and that begins in the prenatal period. So disparities begin with pregnant women and pregnant persons' ability to access resources when they have mental health challenges, their ability to get the support that they need to make sure that their child receives all the necessary supports that'll lead to a healthy pregnancy and healthy outcomes. And then, should any child be fortunate enough to be born and then come into this really awesome world, as Dr. Williams already alluded to, then you have disparities that exist in communities that we see that Head Start tries to mitigate very early on. So what does that mean? Well, here's a fun number. Boys are, I'm sorry, let me make sure to get the exact rate. I believe boys are 4 times more likely than girls in pre-K to be suspended from school. Hold that figure in your mind. Of that number, Black and brown children are at an even higher rate among that population to be suspended in pre-K and early childhood. So we're not even really at numbers or grades yet. And if you haven't heard this phrase, I just want to pile onto this before I talk about the alleviation of these symptoms and these problems. When children are suspended and expelled at these early age, they are more likely to then be put into a system and a process that leads them into prison. And many of us are aware of the rates of Black and brown persons who are in prison. So when does this start? In pre-K, early childhood, during the prenatal period. What can families do? Become knowledgeable about the importance of mental health as early as the prenatal period and then during infancy. Yes, your child, your infant, has a mental health that you should be mindful of. What that looks like is definitely a conversation probably for another podcast, but really I want to emphasize just that idea. Just hold that in your mind. Your infant, your precious 1 day, 2 day, and I'm saying this as a father again of now four, like as early as they come home, as early as you hold them, they have a mental health for you to be mindful of, for you to be conscious of, for you to be intentional about addressing. And in your childcare setting, wherever that may be, at home, at a maybe more organized center, with a group of family members, you should be conscious about what is being done to develop and promote resiliency and to promote protective factors for your infant, beginning there, and then your toddler, and then your school age child, and hopefully, as I can say, as someone who's been in the schools, and I've worked in schools for quite a long time as a support staff. And in DC area, I have visited and been a part of way too many vigils for teenagers who have completed suicide. Like this far too many. And so it really begins as far back as the prenatal period. And awareness is the big thing. Ask your programs, ask your centers, what are they doing to strengthen the social emotional development of the children that they're caring for? As early as, again, 1, 2 day, 3 day, 3 years, 4 years old. And that's just the start, right? And you ask those questions, you get answers of, oh, we're doing this. Fantastic. And if they're not, immediately Google infant and early childhood mental health consultant and figure out how you can get one of those into your area and into your program.
That's incredible. As a mother, it never occurred to me to think about my child's mental health as a 1 day old, 2 day old. So to summarize the section, there's a huge problem. It starts much, much, much earlier than I think most of us that are not in your space even considered. We talked about suspensions. Ms. Hoffman, could you pick up from that? You're in that space, you're working with schools. Why is this happening?
Mhm. Yes, thank you. Same thing everybody said. I'm just happy to be here and be part of this group. So thanks for the invite. I think that there just have been historical practices that have led to this. We think back to, Brown versus Board of Education when, there was supposed to be, integration of schools and there was continued resistance of integration. So students were really kind of pushed out of these spaces. And that was mostly Black and Brown students being pushed out of those spaces. I think back to Clinton's, zero tolerance policy. I think that's really kind of where, we could start with Nixon war on drugs, Clinton's policy. But I think that, the thing I like to tell educators when I'm working with them is that we have these like laws and policies, and they don't even have to include the word race in them to have like negative racial outcomes. So I think that there were policies that are in place that disproportionately affected Black and Brown youth. I always speak to this study in Yale did a study in 2016, and they took educators, and these educators, 132 educators, went into agreed to do this observation, and there was a 4-year-old students, a Black girl, a Black boy, a white boy, and a white girl. And they were told that, hey, when you see students misbehaving, push this button, right? None of the students misbehave. And what they were actually looking at was they were using eye tracking technology to look at, right, like who were they paying attention to? And they were paying attention to the Black students more than they were the white students, right? Which, if you think about a school system, right, if you have this bias that is playing, a part in kind of like how you're teaching and how you're setting school culture, and you anticipate, these Black and Brown students misbehaving, then you're likely to catch them doing things that are misbehaving, which I think leads to disproportionality of them actually receiving, more consequences for those similar behaviors.
So policy plays a really big role, but then there's also family dynamics.
Mm-hmm.
And at Father's Uplift, Dr. Daniels, you were seeing this firsthand. Tell us what you have learned about family dynamics.
Wow. Thank you. I think it's also a great opportunity to be present and on this esteemed panel and an honor. So thank you for the invitation. For me specifically, one thing that we are looking at right now is the assumption that because we may not see a father physically, we may not see a mother physically, that those parents don't care. So I want to completely dismantle that assumption that regardless of whether you see the father or the mother physically, that every parent wants to be the best they can for their children. Now, taking into consideration the mental health epidemic that we currently have in the United States, like for example, the Center of Disease Control found out that over 57.2 million people visiting physician offices annually have a primary mental health diagnosis. That does not include individuals that are undiagnosed. That number would most likely double if individuals were diagnosed. So taking into consideration the dynamic and the breadth of the mental health epidemic and how it is essentially hitting families. And now there's another dynamic here that I want to bring to everyone's attention, the overturning of Roe versus Wade on January 24th in 2022, and how many Black and brown women are dying because they cannot get the treatment that they deserve. But keep in mind, like mothers like Candace, who was diagnosed with lupus and diabetes, could not have a child. We knew that the state of Georgia would not treat her. She took pills and was not able to get the procedure and died with her 3-month-old baby in her arm, and the father of the child found her dead. Keep in mind, she had a child. So when you think about the overturning of policies like Roe versus Wade and how it's impacting various states that are completely outruled abortions, keep in mind that it doesn't affect a woman and her rights. Not only affect a woman and her rights, it also drastically impacts the other parent involved. That father who found Candace dead has trauma. He's going to be raising a 6-year-old child by himself who also is going to have trauma from losing his mother. So when we see the uptick of women dying due to their rights being peeled back in these various states, you're also going to see another uptick of children suffering because they have lost their mothers, of fathers suffering because they have lost their wives and their partners, and now they are left with the trauma of raising their children as well. So when we look at the mental health dynamic, that's going to be another category that's going to be added to add another layer of something that we have to explore and consider. How can we help navigate, support our children who have lost their parents, as well as support our fathers who have to deal with the challenges associated to their wives or their partners not being able to receive the treatment. And also the doctors who could receive felonies for having to treat those individuals, right? There's also another layer of trauma when they can't treat Candace or they can't treat Amber, and the fear that they will lose their license and their livelihood. So we have an issue that we're going to see uptick in the next 4 years under the Trump administration. And I think we're all prepared to deal with it, but hopefully we can do more.
So we've talked about policy, the impact at schools.
Yes.
The policy, politics, regulation, the impact in the family dynamic. And we haven't even addressed yet other toxic stresses. I'm talking about poverty, racism, and those are stressful for anyone. But Mr. Harris, please tell us, how in particular does it impact these young people?
So much so that Kaiser Permanente did a study over decades now on something that many of us may be aware of, but I'll say it again, something to write down in your notes is adverse childhood experiences, which essentially highlighted for so many what many were living, like what they were lived experience that turned into out as adulthood. What am I saying? Uh, Toxic stress is, as Dr. Charles said, is the father raising his child alone who may have a criminal record because someone decided so long ago to have a war on drugs. So his dime bag of weed for his anxiety because he couldn't get the food in his community because it was a food desert now prevents him from getting the job that he needs in this season, which then causes the stress that results in his yelling at his child, who is only doing what they're supposed to do. And so now that child is feared of their father, who's really just stressed because of laws and policies that were put in place so long ago. And now they grow up hyper vigilant and they get into the school, and then the school says, oh, you have ADHD. And now labeled with ADHD, that's tracked behind them with 504s and IEPs, and every teacher's looking at them as that's going to be the busy kid. And so instead of providing them with the opportunity to stand during the test, they're forced to sit, they get anxious. The story's going to make sense if you follow me. And now they get anxious and now they can't do the test. And instead of the knowledge that they have coming out in ways that make sense for them, it's not coming out at all because they're sent into the hallway. They then go to the principal. The principal then feels like they're being disrespectful. They get suspended. And now that child is dropping out of high school.
And,
Toxic stress. I'm sorry, go ahead.
and I get the sense for you, this is not a hypothetical. Like you are seeing this day in and day out, a little bit of a variant on the story, but this is what you're seeing.
Yeah, so the story was a mashup of things that I've come across and things that I've worked with. And so when you talk about toxic stress and its impact at such an early age, as I said, even during the prenatal period, right? The mother who is stressed because they are not now, for example, in this new policies that are, I can't wrap my mind around. But the stress that they're going to feel as a woman. What happens if my pregnancy needs to be terminated for reasons that are beyond my control, and now I can't get that done? I'm the mother and the pregnant woman and the pregnant person thinking about that during that period. The stress that has on the baby that then it's born and is handling that stress, which changes the way they cry and interact with mom, because we know that we need to be nurturing connections at an early on, at an early stage. But now that connection is tenuous because of stress that mother felt, that baby's feeling, and that they don't necessarily have the supports for. We're talking about other toxic stressors for things that are both within the control of people and outside the control of people. Jail, right? Parents who are incarcerated, substance use. All things, for example, that I'm listed just now are related to social determinants of health that have grander things for us to look at, like a larger scope that isn't being looked at in many places and many spaces, but is ultimately resulting in labels upon children as early as 3 and their families as early as their first pediatrician appointment, that results in an impact with a system that will ultimately remarginalize them and separate them from resources that they need to have access to. And so when I talk about the stress and when I talk about how stressful this is, again, I elevate this idea of being mindful that mental health begins as early as infancy for the individual, but for those that surround the child, starts at the awareness of pregnancy. That's where mental health begins, and we should be like elevating that and screaming it from the rooftops, because that awareness changes how we engage with the entire community and with the community that surrounds the child in particular. So stress, yeah, it's a lot. And it's very impactful, and it results in outcomes as adults that are like risk-taking behaviors, that results in, again, incarceration, and it results in substance abuse. It's such a vicious and like sometimes demoralizing cycle that if I wasn't doing the work that I'm doing with the people that I know are doing it around the nation, I would honestly just feel like finding myself a nice little shack in some woods somewhere and living out. So I'm grateful that there are so many people doing this awesome work, because it's really it's hard. It's hard to sometimes wrap your mind around.
Yeah, thank you to all. You have dedicated your careers. Dr. Williams, so we've heard about toxic stress. We've heard about really the impact of policy and legacy policy on people's lives today. Anything else to add?
No, I mean, I think that was just really eloquently said, and I'm just really grateful to again just be a part of the panel, and just want to send some gratitude to my colleagues here. I think the only things that I would kind of add and build on that is this. I think there's this issue of digital health that's really important. The CDC defines, the social determinants of health, the conditions in which we all work, live, play, pray, worship, and so on. But what's left out of that framework is, I think, this digital health space. And, we know basically since about 2009, 2010, that smartphones and iPhones and social media are ubiquitous. And they have contributed to the crisis of child mental health. And while the internet and social media provides a space of belonging for especially marginalized groups, there also can exacerbate psychological distress for children. And we just saw this past week, some folks have been following the headlines as an example, these like text messages that went out to many Black Americans and Black children, racist remarks in the wake of the election. Just one small example of just sort of the daily insults, racist remarks, aggressions that young people see online as they game and engage on social media, and so on. So I think there's a digital health paradigm that's really important when we talk about youth mental health. We already touched on the ways in which Black children and children of color are systematically pushed out of schools and also are interacting with school resource officers in ways that are disproportionate that impact their mental health. So we have to be talking about police-free schools is another really important issue. And I also want to talk about the healthcare system and bias in the healthcare system, I think is another dimension here. So, across the board, as clinicians, we are not taking the complaints, distress of Black Americans seriously, and their children seriously enough. And seriously, as a proxy for that, we're not referring them to specialty services the way we should be. We're not, we prescribe less for Black children and Black families. We are not focusing on internal mood issues like depression and anxiety or bipolar the way that we do with white families. And we're focusing on behavior when it comes to Black children. So there's just this issue, especially in mental health, of just disregarding the complaints of Black families and other families of color that we really have to have a significant paradigm shift.
So this is fascinating because we've heard all these different perspectives. We've heard, mental health is not about this beautiful young little individual and what is going on in their head. It is about what are the policies that are being made at a national level, at a state level, that occur in the school. It is about the toxic stress surrounding that child. It is about digital health. And it is about what you've just introduced, actually, this bias in medical training and possibly recruitment. So it's all these factors. And we've also learned this is a huge problem, and it starts much, much earlier than most of us really anticipated. So let's now turn to my very favorite part of the conversation, because we love to leave our audience with very practical tips and with resources. So this is the part of the discussion where you get a pen and a piece of paper, because the people in front of you have spent their entire careers studying these topics, and we're going to get this great advice for free today for educators and for parents. So let's get started. Dr. Daniels, let's get your perspective for parents. What very practical techniques do you teach parents, and what can listeners start doing today as soon as they are finished with this webinar? What can they start doing to address this issue?
Yeah, so I think one practical technique, I mean, I have several, but I think practical thought is that parenting is not a perfect skill. Our parents are going to mess up at it. They need to embrace imperfection. So as you're talking to parents, you should encourage. You don't have to be perfect to be a great parent. You just have to continue doing your best. That's all you can do, right? Secondly, so that'll be my practical tip. Secondly, right, I have to talk about pregnancy. Given that over 80% of pregnancy-related deaths are preventable, right? There's a lot of things that we can do for pregnant parents. So make sure that they have access to resources. Make sure that you know what doctors, what organizations support operations that certain states do not support, right? Planned Parenthood, right? The Center of Abortion Rights, right? These are some tools that you want to be familiar with. More importantly, there's a 3-digit number that the federal government is really pushing. It's 988. right? So we know, given postpartum depression, again, the number one condition that led to the death of pregnant women, one of the number one was mental health conditions, right? So if you are seeing signs of loneliness, if you're seeing signs of severe depression among pregnant parents, among fathers, among women that are pregnant, call 988. Make sure you utilize that free resource. They are equipped with resources, federal funding, and tools to connect the parents and individuals in your regions to those resources. So a free resource. There's also several other resources that we can share after the call. But yeah, 988 is a real easy one. Keep that number dialed in your phone. Also share it with your clinicians if you have them, and make sure that you're calling. It's similar to 911, and they also have a partnership with 911, right? So 988, if a police is needed, 988 could make that warm handoff, right? So 988, please share it with your family and friends.
Thank you. Love that. Don't need to be a perfect parent to be a good parent. I need to hear that more often. Mr. Harris, Head Start, incredible organization. What skills do they teach educators and parents? What can we come away with today that we can write down today and start doing?
I'm just going to build off of what Dr. Daniel said, which is your relationship to your child as early as they are out is going to be the greatest protective factor. And I'll actually make sure that you hear this word, just your presence. And so your presence is your ability to disconnect from other things and to hold and to hug and to laugh and to smile, to look at, repeat words, giggle, point with. That is going to be the greatest protective factor that you can provide to your child. It will exceed their ability to count and read. In fact, it will support their ability to do those things, all because you were there. And like Dr. Daniel said, I'm going to speak to the educators around these families who are going to just focus on their presence. Just because you don't see them doesn't mean that they are not present and that their presence is not felt in the life of that child. Head Start educates every adult in the system because it supports the entire family from the pregnant person outward. It's all about the connection, right? Head Start will focus on getting you all the resources that you need, but for you, we want you to know that you matter in the life of that child. Mother, father, uncle, auntie, however you're related to that child, you matter. And your relationship to that child matters, particularly if you're focusing on their healthy development, their social development. Educators, you matter. I love that Head Start has made an intentional, and really they've put some of their money behind their mouth in terms of supporting staff. Sadly, it took a pandemic for us to realize that educators matter, but educators knew the struggle the whole time. And so we placed and make sure that emphasis was highlighted for early childhood educators who are loving some of our youngest and most vulnerable babies. And I don't mean babies, just literal babies, but some of our youngest children in our environment. We put emphasis on supporting those staff members so that they're well mentally, so they can show up, so that parents are well mentally, so that they can show up. So I'll say this again, 2 things that matter: your presence, your presence, your presence, your presence. And in relation to that, your mental health matters so that you can be present. So every educator, every parent out there, it's okay to be sad. It's okay to feel stress. Those quick flash thoughts are okay if you talk to someone about it. Because when you get those things addressed, when you find the space to breathe and run, and I'm saying this with 3 weeks old, they'll be 4 weeks old tomorrow, twins. This is a lived experience for me right now, right? It's okay to just ask someone to give you a break, hold them for a moment, walk away. The tantrum will be okay a minute from now. If you breathe for that minute outward, it's going to be okay. Because when you are well mentally, you can be fully present physically and emotionally and mentally for that child. And that's going to make the long-term difference.
I love that. So with the weekend coming up, parents, let's remember these words. Be present, you said pointing together, repeating words, laughing, really being present with that individual is a protective factor. Dr. Dominguez, Child Mind Institute does incredible work with schools. For those educators that are listening to us, that perhaps are not working with Child Mind Institute, what do you teach educators that they could take away today?
Hi, everyone. I was like waiting to say I'm like, thank you. I love being just a learner on this panel. So I didn't even have to say anything. I was like, this is gonna be brilliant. And feel really privileged to be on here. But I think just starting back, I'm just gonna echo and sort of build on a lot of what's been said. But really our mission for school and community programs at the Childline Institute is really to build collaborative partnerships with school districts. And so even our relationship with the school district is paramount as we're talking about what we're providing for educators. So it starts with knowing the community and working with the with assets and what they bring to the table, and we're just adding to it. And so we're really looking at a multi-tiered system of support as we're talking a lot about systems, and when we're thinking about how we can really build capacity for mental wellness in a school. It's not just looking at one arm, but really a whole system. And so we work with educators around providing universal social emotional skills for all students, in addition to helping educators to maybe recognize when students might need more. And so we're working with school-based mental health staff and administrators in providing that referral system to help with evidence-based group trauma treatment in a school or mood treatment in a school. So thinking about access, as we were just talking about it, and how we can utilize school as that point of access when more is needed. But really the cornerstone to anything that an educator is going to do is, like Mr. Harris just said, is the relationship. So we spend a lot of time working on building that student-teacher relationship. We know through research that is paramount. And so what does that mean? It's really looking at our own biases, our own assumptions, our lived experiences, how we're coming into an environment, and also the same with our students. So not asking what's wrong with you, but asking what's
Happened.
happened to you.
Yeah.
Really,
Powerful book.
yeah, and really looking at that lived experience to create that sense of safety, trust, and belonging. And also that comes with understanding trauma and ACEs and what that does to the developing brain, right? We often talk about, unfortunately, it puts us in survival mode. And if we're in survival mode, we are not open to learning. We can't, right? We're just scanning the environment. And so what are some things that we can do as educators to really set the tone and for safety, so that way we can move from survival brain to learning brain, or at least in that space. And so we spend a lot of time thinking about how that fight, flight, freeze, fawn response to trauma might show up in a school environment. And so if a kid puts their head down or needs to stand up, or maybe, it feels like they're refusing to do something, it's more looking at that behavior through this lens to best understand how we can support rather than punish the behavior. And we spend a lot of time too talking about educator wellness. So we often do a lot of work around co-regulation. So the way in which we're going to have these emotion regulation skills in schools is really also teaching educators how to utilize this for their own nervous system as well. So we can do this together in a classroom, and setting up a classroom for success in that way. So making time to check in, touch base, whether it's deep breathe, using your senses to ground yourself, and knowing what your students love, and utilizing that in these processes as well. And lastly, just throwing out there too, just working too with educators on how to identify when more is needed, and of course needing that system of referral and what can happen after. But we utilize the 3 Ds. So looking at distress. So what are these behaviors? What is this emotion looking like? How distressing is it to the student? Duration, how long has it been happening? And also functioning. So really looking at disruption. How is it preventing them from doing the things they need to do or want to do? And so really looking at those 3 Ds. And if we're like checking off like yes, then more is needed. And
Dr.
lastly, sorry, I was just gonna go ahead.
On that point, can you repeat the Ds? That was excellent.
Yep, the 3 Ds are duration, so how long
Duration.
this has been happening, distress, what is the intensity of whatever is showing up, and also disruption. How is this getting in the way? And it's not just for the student, and getting in the way for family, for the educator as well. And so looking kind of at that system as well.
And I want to underscore something that you said earlier about just a simple change to language, not what is wrong with you, but what has happened to you. So I think not just for educators, but for us parents to change our language subtly as well. That's amazing. Let's do one more question, and then we've got some amazing questions from the audience that I want to jump into. And you'll want to stay tuned, because at the end, we are going to provide you some incredible resources if you want to do more research, hear more about what we've talked about. So hang on until the end. But before we jump to the Q&A, Ms. Hoffman, I know you are incredibly passionate about educational policies. We touched on policies a little bit earlier on, but if you had a magic wand and you could change up a few things in a day, what would those be? What needs to change in schools?
One, I would minimize to reduce like suspensions. I think that we need to invite students into schools and not push them out of schools. So really thinking about restorative practices and alternatives to suspensions. I like to tell teachers, it's like when students are struggling with reading, we teach reading. When they're struggling with math, we teach math. And when they're struggling to communicate, properly, then we punish, right? And so it's like, how do we move away from that and really invest in that community and that relationship and bringing them back in and teaching them boundaries and repairing harm and just welcome them back in. So restorative practices, getting rid of suspensions and doing restorative practices. I think that the next thing I would do is like just a lot of training, around bias and cultural competence, but not only the training, because so many people have done training, but where's the accountability measures that we have in place, right? If you are in a school and you have, 20% of Black and Brown students, but there's 60% of your suspensions and your expulsions, right? Then that is an issue. So how is it that, you're being mandated to really address the disproportionality that we're seeing when it comes to in-school suspensions? I think the next thing that hasn't been talked about is just how powerful our students are. They overcome so many things in life and they show up, they show up hungry, they show up tired, they show up while they're taking care of their siblings, right? So there's just so much power. How do we recognize the power in them and elevate them to positions where they're really helping affect change in the community? Things like a peer mediator model and how are they contributing to helping solve conflict? I think that's one really easy way, right? How are you inviting them into the process on the decision making that happens in schools, right? How are you teaching them mental health skills and helping them support others? I know one of the practices that we did at my school is that we had our upper middle school students go and they did a week of kind of social emotional learning lessons, and then they went in with the younger kids and then they facilitated the same lessons, right? So really just tapping into power of those, I think, students are really, really important. And the last thing is I say that everyone kind of implements a community schools model that really has, those integrated student supports, right? Students have what they need to be well, right? That they have ways to engage outside of academics, right? What are the things that they feel passionate about, right? They feel better when they're connected, when they're engaging in things. I think someone already spoke to family and community engagement, right? some of our students their parents have been pushed out of the system. They were people that, were suspended and then, even ended up in the carceral system, right? So how are we supporting them with workshops, with education, with job training, just connecting them to resources, I think is actually important. So I would say restorative practices, I think, and alternative suspensions, that would be one. Just training, cultural competence and accountability would be another. Really recognizing student power, I think, is really important. And I think implementing that kind of community schools model are some of the things that I think are really important to kind of support this community.
Thank you for recapping that. I'd written notes as well. That was a great summary. So let's jump in. We've had loads of questions. Dr. Daniels, could you speak to how support for families and fatherhood has historically been ignored?
Wow, that's a great question. When we think about the history, right, we also look at, again, going back to policy, how certain benefits for families were only provided if the father wasn't around, right? Still this day, those policies carry over into how we operate. We think about vouchers for school, and we think about benefits, and even we think about child support payments, where the father is oftentimes faced with, do I buy myself something to eat, or do I pay this outrageous child support payment? Another example of this, if I'm behind bars in the state of Massachusetts or any other state, and I have not informed the Department of Revenue or whatever that revenue department is that I'm incarcerated, the payments are still charged to me while I'm behind bars, which means if I return to the community, I return with thousands of dollars of arrearages that I cannot afford. That places me in a bind, right? So when we think about systemic inequities, when we think about racism, we think about the cycles of oppression that are designed for people to enter prison, right, and jail and stay there, right? We also see we're going to be transitioning to more privatized prisons, right? So you're going to see an uptick in more incarceration when it comes to Black and brown men specifically. When we're going to make a fraction of the population, but when it comes to the population behind bars, we're the majority. Men and female. So when we think about policies and how that's connected, I think it really creates the tone for fathers to be forgotten about, right, regardless of where they are in society. It also creates the tone for providers in various settings, doctor's office, schools offices, healthcare, healthy start centers, to not necessarily know how to reach out to the father or engage the father based on society's position of the father and treatment of the man in the household, right? From the benefits, from the outrageous child support payments, from the carceral system, right? So when it comes to really doing the work with fathers, we have to take into account systemic oppression. We have to take into account racism. We also have to know that those things trickle down to the providers that are faced with having to work in these entities, that are serving children that are impacted by the father's absence, physically and or emotionally, because we have a saying that fathers uplift. I can be physically absent, but I also can be emotionally absent. And emotionally absent, again, is connected to what Mr. Harris said earlier, toxic stress. It's connected to racism. It's connected to post-traumatic stress disorder. When we think about this emphasis on police and making sure that they have more power, right, under this next administration, right? We're going to see an uptick in more individuals being racially profiled, right? So that's going to trickle down to the children that are in these households that are connected to these fathers. So I say these things. I know this is summary, and I know this isn't a fun conversation. I know that these data points and these could be a wrench into this amazing conversation about infant health. But I cannot talk about infant health if I'm not talking about the parents. The ACEs survey knows that very well. A lot of questions on the ACEs survey ask you about your relation to your parent, right? Have you witnessed, were you neglected by a parent? Were you abused by a parent? That's on the ACEs study. So we have to take into account the parents' experience while we're talking about infants, children, right? So that is my take on
Sorry
that.
to interrupt. For those, we've mentioned ACEs several times. For those listening to us that are not familiar with that term, do you mind explaining what that means?
Yes, adverse childhood experiences, right? So what we realize is that there's an inner child in all of us, right? This is the conceptual framework we think about early relational health, early relationships. Because I'm older and because these relationships are in the past, doesn't mean that these relationships have completely disappeared. We carry them. They contribute to how we act with one another. They contribute to how we rear our children. They contribute to how we rear ourselves, right? So when we think about adverse childhood experiences, think about those early relationships, think about trauma, think about the toxic stress, but also think about how those things surface in relation to how we interact with other people, our children, our relatives, our partners, adverse childhood experiences.
Thank you.
Natalie, I hopefully not to throw you off script because Dr. Charles says something that I think Head Start is addressing, and I really want to give Head Start its props. Is that all right?
Yeah.
Yes, absolutely.
Yeah. Because Dr. Charles, Dr. Daniels, and mentioned interaction with fathers, and I'm really privileged to be a part of a group that I know he's a part of, a network establishing that's emphasizing fatherhood. Because exactly that, we're seeing it even in places like Head Start that focuses on the entire family. That is what Head Start does, giving everyone access to resources. We're finding that some in the system overall don't know how to interact with the father, don't know how to address father's needs, work on biases that go way back, again, talking about that prenatal period, to whom they address. And so a lot of people feel comfortable addressing mom because, particularly in the Black community, mom has been elevated because of the systemic attacks on father. And so even if fathers are present, you'll have schools call mom first. We've heard stories of parents telling the school, call the father, and they will still call mom first. They still don't know how to address the needs of the father as it relates to their interrelationships with their children. This is a real story, and I like to share stories because people know like this is a lived experience. In my birth of my two sons now, I watched and took a kind of mental data of how many nurses would come in and immediately just address my wife without ever addressing me. I'm in the room, I'm in the space, never address me. And so if you think about the messages being sent to me there and what that sets up for me as a man, as a father, and then how that translates to school systems, well, I'm not really necessary. I don't really matter. And when I do matter, it's only for discipline, and that's if I'm present. And then if I'm not present at all, I'm not addressed. And so I love that Head Start, I'm elevating this so you guys know Head Start is making putting intention behind finding strategies and ways and supporting everyone in the network, everyone in the system about how to address fathers and how to address male caregivers because of the ways that they have been treated, and in the only space probably in America where they're the minority. Okay, men make up about 3% of the entire early childhood education system, and of that system, men or Black men and Black and brown men make up about 1.5% of that 3%.
Incredible.
Mr. Harris and Natalie, I have to say this too. I just want to preface this. Me mentioning Head Start, I want to make sure that I'm very familiar with the work that they're doing. And I don't mention names to say that they're not doing a good job. I mention names that we have to continue to say that we need to do better, right? And I know that there's a narrative out there about fatherhood. I want to say this because we're talking about fatherhood right now. Every time I talk to people, when I speak at the Congressional Black Caucus Foundation, when I speak across the country, right? And I talk about the fact that there are fathers that are absent from their children's life, right? The assumption is that we can't say that fathers are absent from their children's life in Black and brown communities because it doesn't exist, because fathers are present in Black and brown communities. I want to be clear. I'm a present Black father. I see my children every day. I love them. I miss them when I'm away. I cry when I'm away from them too long. That's how much I care about their children. But it doesn't mean that there aren't fathers that I see every day in my clinic that are fighting like hell to get back into their children's lives. And if we're going to talk about Black fathers like me that are present in our children's lives, we need to talk about racism and how it's preventing from other Black fathers from being present in their children's lives. Both stories coexist. I do believe as a country, we're doing better, but we got so much work to do, especially when people are weaponizing this narrative that, well, you can't say Black and brown fathers are in their kids' lives. Yes, you can. And you also can say that Black and brown fathers are fighting like hell to overcome racism, to overcome systemic oppression, to be the best fathers that they dreamed of being. But those barriers still exist. So regardless of the various initiatives that we're doing in the United States of America, we have to continue to do better, especially when that narrative out there is being weaponized against minority populations. And I want to put that out there. So again, shout out to those organizations, Head Starts. Shout out to a lot of the child welfare agencies that have fatherhood coordinators. Shout out to a lot of the people that have fatherhood coordinators behind bars. It doesn't mean that that's enough. We have more work to do. And I bring that to our attention today because we have more work to do.
And each of you is doing a ton of work in your individual organizations. I know that the audience has gotten a ton out of this discussion. We got a lovely note here that someone said, even more than the data and information, I appreciate the passion, the empathy, the emotional support that the panelists are getting across. Thank you for being yourselves and sharing your time, wisdom, and heart. I would love to give to our audience some amazing resources that they may not know about. So perhaps we could go around the horn. Dr. Dominguez, Ms. Hoffman, tell us, where can people find out more about Childmind Institute? What is on the website? When should they come to you?
Yeah, so certainly childmind.org, and our school and community programs, you just type in school and community programs and just find out a bit more about how we can partner with you and bring resources to communities. In terms of free resources as well on Childmind, we have the Healthy Minds Thriving Kids Suite. So this is for pre-K all the way up to 12th grade, and it's a free video series resource providing coping skills for kids. It's in Spanish and English, and also there's an accompanying caregiver suite as well with 20 videos from real families talking about issues that we just talked about here and how to address that with kids. So free, you'd utilize it. And the Family Resource Center too. There's just a ton of articles on there that hopefully can be beneficial. And there's a lot of other organizations that do beautiful resource work too, that I have a list of that I'd love to share maybe after this too.
Great. Yeah, we'll put that in the session notes. Dr. Williams.
Sure. Yeah. Now I'll just quickly plug eCenter Early Childhood Innovation Network. So we are a research, practice, and policy collaborative located primarily in Washington, D.C. And we partner with early learning centers, Head Start centers, and also pediatric health centers to help build their mental health programs. So we focus a lot on parent engagement. We focus a lot on genuine community partnership. And so folks are welcome to visit our website to learn more about it. We're always looking for new partnerships. Just visit ecin.org and you can reach out to us. Thank you.
And do you have to be located in the DC area?
No, absolutely not. So a lot of our sort of research and scholarship sort of spans across state lines. So absolutely not. And we're always trying to learn from what other states are doing also. So.
Fantastic. Thank you. Mr. Harris, Head Start, where do people find you? Where do people find the website? And when would they know to come to Head Start?
I'll answer that last question first. If you are working your way out of the poverty section of America, then Head Start might be there for you. And I say working your way out because it ain't going to be your entire story. Well, while you're there, you may actually benefit from Head Start services. Head Start services marginalized communities across the nation who are typically at or below the poverty line. And the cool thing about that is you can receive a lot of the things that you will need to get a really good head start in the program. Quite literally like a one-stop shop. Everything from health, mental health, behavioral health, social emotional health, all there for you, all resources usually connected to the program. If you are not there, doesn't mean you still can't utilize the awesome resources that are collected at the ECLKC. If you Google ECLKC, that website has a tremendous amount of resources that educators and families can have access to. Everything from addressing substance use, mental health, how to strengthen your mental health, how to build resiliency, having difficult conversations. There is a wealth of resources being developed and contributed by a number of national centers to the ECLKC That is a wonderful place to get resources. And for those that are now introduced to the wonderful field of infant and early childhood mental health, I encourage you to go to the Center of Excellence. The Center of Excellence on infant and early childhood mental health. You can actually type in iecmhc.org. Tons of information there about what the field is, but also for those of you who are maybe looking for a slight pivot in your work and field, we definitely can benefit from more infant and early childhood mental health consultants, because these are consultants who are working in early childhood programs directly with communities and families, and making sure that we know, again, that mental health begins as early as 0 and beyond. So I think those are 3 great resources, 3 great places to begin strengthening your knowledge and expanding it in really, really awesome ways.
Amazing. And for those of you that didn't capture this, we'll put it in the follow-up email. And finally, Father's Uplift. If folks want to make use of those resources or perhaps refer the program to someone else, who should be coming to you and where can they find you?
Yes, thank you. So we have our referral form online at www.fatheruplift.org. Fill out the referral, we'll get back to you. Also, if you're outside of Massachusetts or outside of a state that we operate in, we have a resource page with a plethora of resources, national resources and local resources. Go to our website, go to the tab, go down to our resources, and you can find a resource that's fitting for you, like crisis test line. If you text 741-741, free crisis, free text message to a support counselor, and a whole host of other resources that you can benefit from. And also a federal resource, the National Fatherhood Clearinghouse, led by Mr. Patrick Patterson and Kenneth Braswell. They offer free trainings. There's also some support with fatherhood organizations that they can connect you to in their network.
Thank you. This has been absolutely incredible. Thank you for gifting our audience with this hour chock full of insights, resources. I learned so much. I hope you all did too. And to our audience that joined us, thank you for giving up an hour of your time to invest in your youth mental health, whether that's your kids or the kids in your school or your community. Thank you so much. And we look forward to seeing you again in the new year.